In the middle of the night, I got up to go to the bathroom, and I felt myself fall towards the right. I thought perhaps I was just sound asleep, and I slipped back into bed. And then when I woke up at 6:30 in the morning, I could not sit up to save my life, no matter how I positioned myself.
Hello and welcome to Season 2 of the Chair's Corner from the Department of Medicine at the University of North Carolina, Chapel Hill. I am Dr. Ron Falk, host of this podcast where we're dedicated to empowering patients like you with knowledge about your condition, enhancing your quality of life every step of the way, each and every day. Welcome back to the show today. We're joined by two very special guests in what promises to be a fascinating conversation. First, we have Dr. Ross Boyce, who's an international expert in infectious disease and specifically has an interest and expertise in what are known as tick-borne diseases. These are diseases which are more and more common in our area of the United States, in North Carolina, and across the Southeast. So welcome, Dr. Boyce.
Thank you for having me.
My second guest is Dr. Katherine Huffman-Falk. Yep, you heard that correctly, the Falk part, for not only is Katherine a retired nephrologist, she's also my spouse, and she's the individual who developed a tick-borne disease that we're going to learn much more about. Dr. Huffman-Falk, welcome.
Thank you.
So, Kathy, let's walk through your experience having an encounter with what was a beautiful Lone Star tick. Tell us what you recall about finding this tick on you.
On April 29th, I took a nap on a couch that my dog occasionally sneaks onto, and I felt something stick me in the back like a stick, like a pinprick or something. But I thought it was a piece of a brush. And I didn't think any more about it until 10 p.m. that night when taking a shower, I felt this, what I thought was a large, was dime size for sure, tick that was firmly attached over my back, over the lumbosacral spine area, at which point I needed help to remove it.
Dr. Boyce, we're going to start with some basics. What is a tick-borne disease, and what kind of diseases come with the ticks that we have in North Carolina?
Well, thank you for that question. I would start by saying a tick-borne disease is just like it sounds. It's something that you get from a tick bite, and that's because the tick is harboring the bacteria or virus in it, and it transmits it to you when it bites you through its biting parts, its mouth parts. Not all ticks are created the same. 95% of ticks in this area, the central part of the state, that people pull off of them are going to be Lone Star ticks. But we do also have dog ticks and deer ticks, and there's a new one that's come into town called the Gulf Coast tick.
How can I figure out one from the other? Is it impossible to do that?
I think for most folks, unless it is a female Lone Star tick, an adult female Lone Star tick, and it has that white spot on its back, most folks can't tell them apart, can't even tell them from chiggers or sometimes other bugs.
So, Kathy, there you are with this tick, and you summon your husband who comes in and with a pair of tweezers tries to extricate said tick and thinks he's done a great job. And what happens next?
I took a picture of it because I'd only seen Lone Star ticks in pictures, and it was clearly a Lone Star tick, and it was bigger than any tick I had seen. And I notified my physicians that I had been bitten and was instructed to observe for symptoms. And for 8 to 9 days, I had zero symptoms. I felt perfectly fine.
So, Ross, tell us then about the Lone Star tick versus deer ticks, and generally what is carried by one versus the other.
So the Lone Star tick is our main vector. That's what we say. It's the one that transmits Ehrlichiosis. It can also transmit some viruses that are relatively uncommon, but we're discovering them more and more. These are things like bourbon virus and heartland virus. And outside of my area of expertise, but they're also thought to be the main vector of the red meat allergy, also known as alpha-gal. In contrast, deer ticks, which are also called black-legged ticks, are the main vectors of the things that we traditionally think about being up in the northeastern region. So that's Lyme disease, babesiosis, anaplasmosis. But the ticks are not interchangeable. They all can't carry the same diseases. Each one carries a different sort of grouping of diseases.
So we hear about Rocky Mountain spotted fever coming from a tick. Which tick does that come from?
So it's really complex because Rocky Mountain spotted fever is part of a broader group of bacteria called Rickettsia. The one that is responsible for really severe disease is called Rickettsia rickettsii and is transmitted by the dog tick. There's some other ones that are less severe that the Lone Star tick can transmit, but that gets really into the weeds on some of these different bacterial species.
And if you find a tick, what are the chances that that Lone Star tick is going to carry a nasty bug?
We have collected and ground up and tested some of the ticks that we get from this area. In regards to Ehrlichia, it's probably anywhere from 5 to 10% of the ticks are actually infected. But that doesn't mean that 5 or 10 ticks are going to infect you. A tick has to be attached to you for a number of hours to transmit that. So if you get that tick off pretty quickly, the odds of it actually transmitting the bacteria to you is relatively low.
Kathy, 8 days later, you suddenly start feeling what? What do you feel?
In the middle of the night, I got up to go to the bathroom, and I felt myself fall towards the right. And I couldn't believe it. I thought perhaps I was just sound asleep, and I slipped back into bed. And then when I woke up at 6:30 in the morning, I could not sit up to save my life, no matter how I positioned myself, and the ceiling was spinning, and I was nauseated. You had to help me sit up, and then I vomited.
And that was we found out, due to something called an inflammation of a cranial nerve that was inflamed. This possibility of having any kind of tick-borne disease causing a neurologic event of any kind, how common is that?
It's pretty well described with Lyme disease. I think with Ehrlichiosis, it is not as well described, but if you look at the few reports in the literature, it's anywhere from 10 to 20% of cases have some neurological involvement.
Kathy, at that point, you did not have a temperature.
I never had a fever, but I felt flu-like. Other than having nausea, vomiting, and diarrhea, I really could not do anything that day. And I kept thinking it was something I ate, but there was no explanation.
Did you have a headache with it?
I certainly did. I had a specific headache on the right side.
So this feeling of a flu-like illness and headaches, how does that fit?
Perfectly. Goes right with my experience of what I see in patients with ehrlichiosis.
Describe more of those symptoms that you see in your clinic of other kinds of patients.
Sure. So it's important to realize, and your history is almost textbook, that there's what's called an incubation period. And that's the time between when the tick bites you and infects you with the bacteria and the onset of symptoms. And that tends to be anywhere from 3 to 14 days. So you're right smack in the middle of that. And what people tell me they tend to experience is fatigue, flu-like symptoms, headaches. I hear people frequently tell me that they have nausea, vomiting, occasionally diarrhea or other types of upset stomach symptoms. And about 20% of people have a rash. And this rash is not like Rocky Mountain spotted fever that we all get taught in medical school that has the palms and soles, but it's much more of a sort of pink rash, and I most frequently see it across the chest and the back.
So, Ross, how often should you get a tick panel, and what's in a tick panel?
So what we call a tick panel here at UNC consists of antibody-based tests, generally for Ehrlichiosis and the Rickettsia family, which causes Rocky Mountain spotted fever. You can add lime to that if you want. As far as when you should get it and how to use it, I think there's a lot of confusion. It's an antibody-based test. It takes our body some time to develop an antibody in response to an infection. So you cannot use it, and I try to emphasize this a lot with physicians, you cannot use it in the acute period because it could be negative because you don't have the disease, or it could be negative because you just haven't mounted a response yet. So it's really to confirm a diagnosis, and it requires a second test a few weeks later. If you think someone has it or has any tick-borne disease, you really almost have to decide to treat before you get any test result back.
So, Kathy, that was what was initially done because the concern was that you had an allergy to one drug, which we're going to talk more about, doxycycline, and you were put on an alternative. You want to describe that, please?
I was initially put on azithromycin, which I took for a week, but did not get any better, and was put on prednisone for the vestibular neuritis. And I still felt terrible, and the tick panel came back showing Ehrlichia, and I was instructed to start doxycycline. I regret very much that I had put doxycycline as an allergy on my chart, and that was based on an experience 30 years ago where I felt that like it got stuck in my esophagus, which is a well-known phenomenon, but not an allergy.
So once you started doxycycline, how quickly did you feel better?
Within 24 to 48 hours, I felt that I could think again. I didn't need ondansetron, which is for nausea. I felt like I could walk. I felt just a remarkable improvement.
So, Ross, if you are going to treat, and the antibiotic of choice is what? It's doxycycline.
It's doxycycline for almost all of the tick-borne diseases, including Lyme disease. There's just a few exceptions like babesiosis, but otherwise, if you suspect that there's a tick-borne disease and you feel that there's enough evidence to treat, it should be doxycycline, 100 milligrams twice a day.
For how long?
So this is another area of I don't want to say misinformation, but maybe confusion. You really only need 3 to 5 days. It clears the bacteria very quickly from the bloodstream. So the recommendation from the CDC is 3 to 5 days after the fever ends, but not everyone has fevers. So generally, I recommend 5 to 7 days in total.
And you got better, Kathy, within a relatively short period of time.
I mean, a significant improvement.
So, Ross, help us understand Kathy's symptoms. You're bitten, this bacteria, Ehrlichiosis in this case, gets into the blood. Where does it go?
Yeah, I think there's a lot that we don't know about what's called the pathogenesis, or why the disease develops after the infection. We know that it infects the monocytes, which are one of the white blood cells, and that's why its traditional or full name is human monocytic Ehrlichiosis. But it doesn't cause direct damage to the body in the way that Rickettsia does. So Rocky Mountain spotted fever causes so much damage because it invades your blood vessels and destroys them, and you end up just leaking out of your blood vessels. Ehrlichiosis doesn't do that, but I think it's actually, if you asked me kind of why is this happening, it's because it triggers a really robust immune response that is almost in the same way that some of what the damage COVID does is our own body kind of getting inflamed and reacting to the infection. And I think that's why we see some of these nervous symptoms. 20 to 30% of patients with ehrlichiosis are ultimately admitted to the hospital.
So if you're bitten by a tick and you see this Lone Star tick and you're not sure whether it really latched on or not, when are you, Ross Boyce, going to start your doxycycline?
Yeah, it's a really hard question, and I get asked that quite a bit. So unlike Lyme disease, so in the Northeast, there are recommendations that if you are bitten by a deer tick and it's attached to you for a certain amount of time, you can do what's called post-exposure prophylaxis, and you get 200 milligrams of doxycycline that you take once immediately after the tick bite to prevent the disease from developing. The CDC actively recommends against that for ehrlichiosis and Rocky Mountain spotted fever because there's a fear that there'll be more severe rebound disease. That's based on a 45-year-old guinea pig study. I don't think that that is valid, and I think it needs to be explored. However, it is the current guidance, and so I don't just throw post-exposure prophylaxis at anyone who's had a tick bite. Part of that is because, as I said, 5-10% of ticks are actually infected with Ehrlichia. So the odds are in your favor, but you do need to keep a close eye on yourself. And as soon as you develop any symptoms, and it can't just be fever. So the CDC recently took fever out of the case classification, the criteria, because a lot of people don't have fever when they get ehrlichiosis. But as soon as you start feeling unwell, as soon as something is not right, and people generally know their own bodies, I would say get the doxycycline started.
So, Kathy, you ended up taking doxycycline. Once you started it, you took your 5-ish days, and yet even a week or 2 or 3 later, how do you feel?
After the doxycycline, really within 48 hours, there was a sense of relief of the weight of the fatigue. But the fatigue is not like, I think I'll close my eyes. It is a 2-hour nap kind of fatigue. And that part has gone away completely. I feel more and more like myself. The 2 lingering symptoms are some fatigue, although it's so much less that's hardly worth mentioning. Vertigo is still a problem when I am fully supine, so I have to sleep with the head of bed at 5 to 10 degrees and get up slowly.
So, Ross, how common is this almost post-infectious fatigue, still not feeling up to snuff?
So if you read the textbooks on this, they'll say it doesn't exist. It's not a thing. There's a little bit of data around Rocky Mountain spotted fever, largely from people who had very severe disease, were in the ICU. But for anyone who's been in the ICU, you can imagine there's probably some period of recovery. As I've gotten into this more and seen more and more patients, I would say that I started to recognize a pattern. And we did a cohort study where we enrolled people who had been tested for tick-borne disease, and then we followed them. So we followed some who ultimately ended up having the disease and some who ultimately did not. And about 20% of those who had a confirmed ehrlichiosis in our cohort were still reporting some moderate or severe symptoms 90 days after the infection. And I'll say that we only added those questions about 30, 60, and 90-day symptoms somewhat on a whim, just because we didn't really think we would find anything. But as I've, both in my research and clinical practice, this is just more and more common, and I see it all the time now.
It's almost like a post-COVID kind of.
Exactly. And that's a good way to explain it to people, to let them know that the infection itself is gone. There's no reason to think the bacteria is hanging around in our body. You don't need more antibiotics. But for some reason, whether it's because our immune system is ramped up or there's some persistent antigen in the body, we just don't feel right.
If you're bitten by a tick and you've seen the tick and you've had somebody take it off of you, that's one thing. But if you're starting to develop these kinds of symptoms that you've described, the tendency is going to be, well, I've caught another viral bug that's running around. It's the spring, summertime, and it's my turn to get my virus from my child. But yet it could, in fact, be if you're tired, if you have a headache, if you have a fever, or any of these neurological symptoms, it could have been from a tick that you just didn't know bit you, because some of these ticks, I guess, are really small if you think they're the size of a grain of sand. When do you test those people?
Yeah, so that's a really good question, because less than half of people with a confirmed tick-borne disease ever find a tick. And that's because, as you say, ticks can be small, but ticks have also evolved to go to places on our bodies where they will not be found. And that can be our armpits, behind our knees, hairlines. And so certainly when we're asking patients, did you find a tick? If the answer is no, it is not a rule out. It should certainly remain in your differential when you're thinking about what could be causing these symptoms. And the other thing that can really guide that is what time of year is it. Now, our tick season here in central North Carolina keeps getting longer and longer. I would say it probably runs from March to October right now.
And then do you order those antibody tests, that tick panel?
Right. So not, and the same thing, there's a knowledge or a common wisdom about ticks that you get them when you are out hunting or you are camping deep in the woods. About 40% of people that I've seen got it in their backyard.
Or on the couch.
Or on the couch. And this can be gardening. Ticks, there's certain ticks that like to attach to birds. So if you have bird feeders, tick can just drop off right underneath the bird feeder. Those deer that come through your backyard. If you've got dogs, even if they're on preventative medicine, they can still act as a transport, a highway for that tick to get from the backwoods into your yard, into your house, onto the couch. And so my advice is if it's the right time of year and the symptoms are broadly consistent, you should really think about it. Now, as I mentioned, the tick panel itself is not useful in that acute setting. I order it because you need the first one in order to utilize the second one. But when it comes to making a decision about treatment, you got to pull the trigger or not based on your suspicion of the symptoms and how sick the patient is.
Kathy, let's talk about that drug allergy bit, because it's really common to list medicines as an allergy because on the electronic medical record, there's no way of really describing drug toxicity. It's always put in as an allergy, but it's not really an allergy. It's that you have symptoms when you take the drug.
This has caused me to revisit my chart and to remove any drug that is listed as an allergy that really is not an allergy but had associated adverse effects. And so I think there is a message for every one of us to be cautious about listing something as an allergy, because then the prescribing physician is going to naturally avoid those drugs.
Yeah, it's something that all of us have to worry about. So, Ross, let me ask you a research question. If you Google ehrlichiosis, the things that come up are ehrlichiosis in dogs, ehrlichiosis in other animals. The amount of information about ehrlichiosis in humans is really difficult to find. And as you point out, the understanding of the disease course, even from the CDC, seems limited at best. How are you trying to reshape that understanding of what this disease is, how common it is, and how we can appreciate and study it better?
Well, thanks for that question. I generally consider Ehrlichia and ehrlichiosis really a neglected tropical disease. If this was in Panama, we would call it a neglected tropical disease. It's not. It was actually discovered in Arkansas on an Army base, Fort Chaffee, which is why it's called Ehrlichia chaffeensis. And that happened in the mid-1990s when a bunch of soldiers on weekend drill got fevers. But since then, if you ask me how much progress have we made, I would say very little. One limitation of that is the antibody-based test that I mentioned. It's really hard to identify someone who has ehrlichiosis quickly if you rely on an antibody-based test. Not to make it too confusing, but there are a number of different Ehrlichia species, some of which infect humans, some of which infect dogs, some of which infect cows. There are at least 3 that infect humans and cause human disease. We can't tell them apart because they all cross-react on the test. So I don't know whether someone who gets neurological symptoms is getting it because they got Ehrlichia chaffeensis versus Ehrlichia ewingii. So that's a real big research gap. Are there specific clinical syndromes associated with the different species of Ehrlichia? What is the distribution of these different Ehrlichia species? We don't really know that. We have found Ehrlichia ewingii here in North Carolina. We found chaffeensis. Depending on where you go, might be more of one than the other.
And wouldn't it be nice if there was a rapid diagnostic test?
I'll put in a little plug for we do have an Ehrlichia PCR here at UNC. That
polymerase chain reaction?
Right. right? A molecular test that Melissa Miller here at UNC developed. Again, it's not perfect. It still takes a little bit of time to come back, but instead of waiting for that second test, which is 4 weeks later, maybe you wait 3 or 4 days. I think they're actually better than that. So that is one thing, but again, depending on which one you have, it can either be Chaffinsis specific or Pan-Ehrlichia, so you don't always get the information. The other thing I'm really pushing is what we talked about earlier, which is this question of symptom persistence and trying to understand why that happens and what we can do about it, I think is the more important part. Right now, I'm largely just following treatment guidelines for long COVID or chronic fatigue. But maybe there needs to be something specific for this, and I think we have a long way to go there.
Last question. I'm going out in the yard. I'm going to go muck around with the dog. How do I prevent myself from getting this in the first place?
Yeah, we really don't know how to control ticks.
So I can spray myself with one insecticide spray after the other. It's not going to stop it?
I have 3 kids. They are 10, 8, and 7. They go in the backyard. I do not get permethrin or DEET on them every time, as you might imagine. They get out the door before I could do that. They're not home, whatever it may be. I recognize it's hard. The only data on tick control that has really been effective is from controlled burns from military bases. And obviously most people don't want to light their whole backyard on fire every couple years.
Probably not.
There are things you can do. Ticks do not like to be dried out. If your grass is mowed back, they don't like to be in those areas. They like leaf litter. They like to be under bushes where it's shady. And so we think that that barrier where the grass meets the natural area, where the grass meets that beautiful forest area behind your house, is probably the high-risk zone. We don't have data, but if I was to spray a certain area, I would do kind of a meter right at that edge. I would keep my bushes and shrubs trimmed back along that perimeter. And then with little ones, if you have little ones, when it's bath time, give them a full body check every once in a while, just to make sure there's not something you're missing.
Dr. Boyce, Dr. Katherine Huffman-Falk, thank you so much for helping us understand this complex and, as you point out, really under-recognized illness. Kathy, thank you for sharing your experience. We're so glad you're feeling better. I am most particularly glad you're feeling better. Thanks for joining this podcast.
Thanks to all the listeners. I hope that you learned something.
Thanks for having me. It was a pleasure to be here.
Remember, you are not alone on your health journey. Stay informed, stay proactive, and together as a community, we can make a positive difference in managing your health and well-being. Thanks so much for joining us. Take care.